Despite decades of remarkable progress, cardiovascular disease remains the leading disease burden in the region of the Americas, accounting for 1/3 of all deaths and producing substantial adverse economic and social impacts. This article introduces a new, improved application, the main component of which is the calculator for cardiovascular risk and hypertension management. The cardiovascular disease crisis is consistent with the high prevalence of its main risk factors at population level. More than 60% of people in the region are overweight or obese. 20% have high blood pressure. On average, 9 grams of salt are consumed per day. 80% have raised blood glucose, and 50% use tobacco. Poor control of cardiovascular disease risk factors results from a lack of awareness among individuals of their risk status. Therefore, healthcare providers are essential to identifying risk level as a means of detecting those at high risk of cardiovascular disease and identifying who could benefit from treatment for hypertension, diabetes, and dyslipidemia. Hearts in the Americas transformed the 2019 cardiovascular risk charts developed by the World Health Organization into an online electronic calculator, updating the previous 2014 CardioCal app. After the user enters the requested data, the risk calculator quantifies the 10-year cardiovascular risk for myocardial infarction, stroke, and death from cardiovascular disease, with color-coded risk categories ranging from green to dark red. It incorporates the specific standardized hypertension treatment protocols defined by Ministry of Health in the countries implementing HEART. For countries that have not yet adopted protocols, it includes a generic protocol. How can the tool be optimized in clinical practice? The Heart Cardiovascular Disease Risk Calculator provides a reliable and accurate estimate of risk using easy-to-obtain demographic and biometric data. It is simple to use, provides an estimate quickly, as well as clear recommendations that are appropriate for the individual and the care setting where it is being used. Training to use this tool is simple and quick. The optimal use of the HEART app also involves applying it to high-risk individuals, such as people aged 40 to 74 years with known cardiovascular disease, diabetes, or chronic kidney disease. In such cases, the tool's value is to enhance treatment guidance about managing risk factors based on the individual risk profile. For example, the HEART app may recommend a lower treatment target for blood pressure and more frequent follow-up for high-risk individuals. Additionally, people with known cardiovascular disease may be advised to consider aspirin and statins therapy, or the healthcare provider may seek input from a specialist. The HEART app aims to help individuals and health professionals to improve their understanding of cardiovascular disease risk and the relevance of detecting and addressing modifiable risk factors, and to support proven interventions that are part of the health strategies implemented in most countries. It is a powerful clinical tool that can help to improve the effectiveness and efficiency of interventions and improve the quality of care in primary care settings. Accordingly, the HEART app is an essential step in the journey toward reducing preventable cardiovascular disease in the region of the Americas.